The purpose of this tape job is to support the shin for shin splints, and the proper taping position for this is to have the athlete with their knee bent at 90 degrees. I like to put either like a tape roll or something to raise up the heel because it gives us more room to tape. So we're going to put that up. The next thing we want to do is have them bring their toes all the way towards their shin. This is called dorsiflexion, like that. Because we want the muscle at the biggest point possible when we do any tape jobs. Now with this tape job, if the person is hairy, we will use pre-wrap. If they're not hairy, we can go straight to the skin. I'm going to show you with pre-wrap so you can practice with pre-wrap. Okay. Again, we tough skin. Where we want to tough skin from is the base or the bottom of the ankle or the top of the ankle, all the way to where the calf turns into a muscle or where the tendons turn into a muscle. So some people it's going to be easier to find that than other people because we don't want to go in. We don't want to tape into the muscle because you can cause the muscle to cramp here. So we're going to pre-wrap. Remember, this is the correct way. This is the incorrect way. Correct? Incorrect. All right. So we get our pre-wrap. We start at the bottom of the leg, and again we want to pull a pre-wrap really tight, and we're just going to work our way up the calf. Again, less pre-wrap the better, or excuse me, up the lower leg. We want to stop right about there. Here's our calf, and that's where it's a tendon, and I just kind of go down real quick like that. So we pre-wrap because we want to cover this whole area with pre-wrap so she doesn't get tape blisters or anything like that. Notice I'm keeping my hand on the pre-wrap. If I don't, it's going to unravel. We grab our tape, and our first strip down at the bottom is just straight across. Now there's a little saying with shin splints, if the pain is on the inside or the medial side, we want to ask them what side does it hurt on. Sorry, I forgot to say that first. What side does it hurt on?
The inside.
So it hurts on the inside. We always want to pull into pain. So the easiest way to remember this is if it hurts on the inside, start your tape on the inside. So if her pain was on the outside, we'd start the tape here. And if the pain was here, we would start the tape here. So always just start the tape on the side that you're on. Now if you notice the bottom of the lower leg is at an angle, it's thinner, then it gets thicker. We want to make sure that our tape is in a particular angle when we tape, because if we go straight across up this leg, it's going to start wrinkling. So our angles are going to change as we go up a leg or if we go down a leg, depending on which way you're going. But we're going up a leg, so that's why I have my tape at this angle here. So I'm going to go start here, go around, cut it, and all we're going to do is work our way up the leg. We're going to go half the distance of the tape and split. We want to make sure that our tape ends cross over, because if we have them like this, it's going to split open real easy. We don't want that to happen. Half the distance of the tape. And as I move up the leg, my angle is getting wider or bigger. And that's a good spot. We can, let's go one more. It's kind of a guessing game on how high it should be. These strips should be nice and even going up the leg. We don't want them too close together. If they're spread apart, you'll see gaps in the tape. You'll see the pre-wrap between the gaps, and that's telling you your taping is too wide. It should be fairly snug. You don't want it super tight so her toes turn blue. Should give her nice support when they're playing. And